Welcome one and all to the fourth episode of Pragyan Talks, a talk series that aims to delve deep into pressing topics to provide insight to the audience through esteemed experts across the globe. The series focuses on the aspects of life once the immediate danger posed by the pandemic is averted to a considerable extent. But is it possible to know when the crisis would end? To discuss these aspects of the healthcare system which have been affected by the crisis, today we have with us Dr. Ashok Seth.
Dr. Ashok Seth is presently the chairman of Fortis Heart Institute and the chairman of Cardiology Council, Fortis Group of Hospitals. He is regarded highly in India by several doctors for his experience in cardiology. Dr. Seth has led the field of interventional cardiology for the last 30 years and has contributed extensively to the development, scientific progress, and education in interventional cardiology in India and across the world. Dr. Seth has also been awarded the Padma Shri in 2003 and Padma Bhushan in 2015. India's fourth and third highest civilian awards, and B.C. Roy National Award for the most eminent medical person of the country by the President of India in 2017, to name a few. We're looking forward to interacting with you, sir, over the next few minutes, and we shall begin with the session.
Thank you very much, Sai. Thank you very much, Anushri. Right at the outset, let me just first say that I'm actually behind a mask for a very specific purpose. I really want everyone to understand and imbibe the fact that this is how we should actually be leading our lives if we want to stay safe from COVID and to actually decrease the progression of COVID. And the masks have to be worn properly. So while speaking, there is no reason to take off your mask. You have to cover your mouth, have to cover your nose, and that's the new norm. But I can take on the mask. I'm going to take off the mask now. This was with an emphasis that mask is a part of your personal clothing nowadays, and it's going to be for some time, as much as physical distancing, one would say, not social distancing. I think we should still be a part of the society, interact with each other closely, but physical distancing. And of course, washing hands as many times as possible. Anything as you touch, sanitize it regularly, and that is going to be a very important aspect of your hygiene. Now that I'm in my room alone, and that there's nobody with me, I would be taking my mask off. So that we can now interact with each other face to face, as it is said. So now I'm alone in my room. So let me first start off by saying, Anushri, let's make this an interaction rather than an interview. It's always a pleasure to meet young gen, intelligent folks like yourself. And I must say, I enjoy it far more because it's not for me to impart my experiences, knowledge, but as much as I gain from you every time I converse with students like you. You come from one of the finest institutes of the country, the NIT in Tiruchirappalli, and you're also motivated and eager to stretch new boundaries, new vistas, cover, your mind's working beyond what the physical boundaries are. So let's have a conversation rather than an interview. And I'm therefore very happy to be sitting with you all. And let's not even limit it to the specific time, because I've spared my time only so that I could enjoy this conversation. And if you continue to enjoy it, then time is not a problem for me.
Yes, sir, we're looking forward to this session, and I hope people do get a really strong message from what you conveyed about masks and social distancing, and I hope people do follow it. To begin with, firstly, I would like to talk about a vital aspect for the development of any system in any country, which is like the base foundation upon which the rest of the attributes can be built. It's often said that we reap what we sow, and this is definitely where the foundation lies. Education and research are the two pillars on which a sound healthcare model can develop. Where do you think India is headed in this context?
This has been one of the various big deficits in India. India's got the biggest intelligentsia in the world, and that is well amplified with the amount of innovative research that we see from Indians based across the world, be it Germany, be it England, be it America. Look at the Nobel Prize winners, look at the seminal researchers which have come from abroad. And if you then say, why aren't these Indians here doing similar research? Then comes the aspect. You ask me, education and research. That's where the problem lies. We start believing that research is something separate from education. Actually, it's a part of education. It's only in India that we start believing that these are two separate pillars. That has been one of the unfortunate fallacies where we've said, okay, who wants to do research? Go into a separate field. You are going to be a researcher. Now, the reason, if you actually see, and I was looking at these statistics from last year, that while there was 5% peer-reviewed publications of good research coming out, their citations were only 2%, and we spent only 1/5 of China does in research. We only spent 1/20th of what France and America does in research as a country. So we haven't valued research. That's the first aspect that I wanted to say. Second aspect I want to say is that why would anyone like you or even me do research? We need to know what are the advantages of research in our lives. And if there's no advantage to us in our lives, the impetus for doing research goes away. And unfortunately, India has not valued research. So there are three aspects. It hasn't built up the milieu for research, but it has also not valued research. When we talk about valuation, in the West, your progress in your profession, and that doesn't mean you need to be research-oriented profession even. As a doctor, if I was to become a consultant, it would not happen unless I'd spent 2 to 3 years in pure research, actually doing science, actually doing some innovative, fresh research into various aspects of the specialty in which I was. That's the competition. It's how many fresh publications you have, how many new ideas that you actually contributed to medical science. That becomes so important when you move up. The same thing happens in academics. Now I'm talking about even a general hospital cardiologist can't become a consultant if he didn't do 2-3 years of research, had a degree or a PhD in research, and actually gave out some good papers. That's even a general cardiologist in a general hospital we're talking about. Now you talk about academics, and the professors need vast amounts of real fresh research. So it becomes a part of your career growth. The differentiator is not how good you are, how skilled you are, how much patient following you have. It is due with what science what did you contribute to science. That's the second aspect. The third aspect is, so it has to become an integral part of your life, growth, profession, and you have to devote time to it. The third aspect is creating the milieu for research. Actually, research should not be away from education. It should be part of education, even at undergraduate level. Now, we tend to say, okay, we've done undergraduation. Now, let's do MSc and PhD. That's research. And BSc is not a research. B is not a research. If you wanted now to progress beyond something, you'd say, okay, if I was going to do research, let me do a PhD. And now, or a master's and then a PhD. Why is that so? Why aren't we actually inculcating how to do research, the education about research, the understanding about research, actually writing up a major thesis during that time, and actually thinking of fresh ideas like you're brimming with ideas. Why doesn't that go into some form of a thesis and a research project which actually bears fruit to the present science? And finally, what have we done to promote it? How much funding do you have? If you had to do research today, you would be doing it out of your own passion and own creation and looking for funds which are not going to be easily available. You're actually going to progress on that path, striving full with hardships. And finally, it's your own initiative which is going to deliver. There's also one more point which we should discuss, I think, as students. And that is, there are numerous ways to progress in India to the top without doing research. And then, unfortunately, it's not your excellence which drives how you get to the top. There are numerous shortcuts to it, as you know. You yourself have seen around. There could be reasons for a person getting to the top. There could be connects for a person to be getting to the top. He may not have performed so well intellectually. He may not have contributed much, but he'd still be at the top. There are numerous shortcuts to it. And I don't need to define those, but you know it. Contacts, PR, activities, in fact, making sure that the person didn't even get into a lab and yet has publications, making sure that there are numerous seats reserved anyway for such things. So when you see that, and there's competition around you, the impetus for research goes down, and even your bosses, unfortunately, if they haven't done good science or research, cannot be guides to you and will not stimulate you. In fact, some of them will actually put you down occasionally, saying, why is he going to be such a bright guy when I did not do much research? So I think we've got to combine everything. That's the milieu which is there in the West, where it's encouraged right from the beginning. That's the milieu, unfortunately, in India, where our own initiatives drive research.
That was very well said, sir. And I think it's something to ponder upon for many of the students in our college, as many of them want to pursue research and things like that.
It's to say, Anushri, it's actually the most, it gives you the biggest satisfaction. When you get to the top of having contributed to science and research, you personally feel most satisfied, whichever profession you are. And even as a clinician, I only feel satisfied because of research. Just to give you an example, how backward in our thinkings we are, and I say that for my own family. I trained in England, and I had to do that research job, like I said, to progress up my career. And when I told my father, who was here as a doctor, that I'm going to do, I'm after this, after being clinical and I'm being a registrar in cardiology, now I'm going to do a research registrar's job in cardiology, he automatically said, I didn't send you to England to be a lab-based technician. I sent you to be a doctor. That's the psychology we need to change. Researchers contribute daily to every clinical or practical aspect of life.
Absolutely, sir. So speaking about the current situation in retrospect, there are many similarities between the current outbreak to the SARS one, from its geolocation to its spread to the viruses themselves. However, much has changed within the 17-year gap between these two outbreaks. New technologies that were non-existent are now more affordable and widespread and can help manage and even prevent such cases. How has this reflected in the ways we are battling the outbreak today as compared to before?
So, Anushri, it's so surprising that you asked me that. 17 years ago, yes, we had the, the SARS, but it infected only around 9,000 people, out of which 8 to 900 died. And it affected 27 countries, 17 years ago. MERS came in 2012 and affected 3,000 people and killed another 900. So really, these were isolated in pockets, weren't very virulent. They had a high mortality, but they weren't very virulent. In fact, we were never prepared for this, and you've seen that happen. Actually, this is like a pandemic which nobody had thought would ever get to this proportion. And it's totally fresh virus. It's new. It's different in every way. It's far more virulent. The mortality is less compared to SARS. And each virus is its own. But what's different is that no one across the world, after 1919, when there was the influenza pandemic, nobody believed that we could actually come to this sort of a situation of a pandemic of this proportion, which would affect 220 countries, and to this date has nearly affected 11 million people. So this is huge, and 500,000 deaths. So nothing that we did in the past was ever meant for this sort of a pandemic. Yes, our advancements in science and technology were meant for daily diseases, which we were seeing in front of our eyes, for treatment of those in better manners. We take it coronary artery disease, take it heart attacks, take it cancer, take it any form of neurological disorder. Yes, we've had tremendous advancements in science. We've been able to save more lives from the daily diseases that we knew of. Remember that COVID-19 is a disease process we still don't understand even as of today. There is still no proven treatment for COVID-19 as of today, and we still am battling the daily knowledge that comes out of experiences, and we still not conquered it, and it'll take us quite some more time to conquer it. So the last 17 years have not contributed. It's the last 3 to 4 months which have contributed to the science, technology, understanding, and figuring out how to control this deadly disease process. We are getting there. Don't think that we won't get there. Human minds and science have advanced enough in terms of understanding to even break this, and we'll come to that. But clearly at this time, my message to everybody is that despite every aspect, be it science, be it infrastructure, be it knowledge about immunization and virology, be it medicines coming out, be it immunization or looking for vaccines. One of the important things is that this time, it actually also lies in our hands to prevent ourselves. It lies in us not to spread the virus further. This virus is going to stay with us. We're going to have to learn the good things that we learned about physical distancing, masking, washing hands, and not congregating together in large situations. And of course, the new norm of talking like this, learning like this, interacting like this. And we will beat this virus. It's just a matter of a few months, a year, and we will beat the virus. That's the message at the moment. So it's in our hands now.
Yes, sir. That's actually a very interesting way to look at it, because it's misinterpreted by so many people around the country. And like talking about the frontiers in science, I would like to address another topic. Like this is one of the frontiers that's expected to be the future. And I would definitely love your insight on this, as it's something widely misinformed, but I feel it's the need of the hour. It's about artificial intelligence. Artificial intelligence technologies and virtual care opportunities have been pushed to the forefront in recent times. How effective has virtual healthcare been in this healthcare crisis, and how can we improve on this further?
You're so right. This is actually, in a way, one had been pushing virtual healthcare in the past in terms of remote consults, in terms of televised or video consults, but it hadn't been working out in a big way. You know that it hadn't picked up. But this is the time, of course, it has been so valuable. So let's come to virtual and then go to artificial intelligence. So virtual has been important. Virtual has actually helped people to seek consultations, make sure that they don't ignore the disease process, renew their prescriptions, talk about new symptoms. And it's so important for them in a situation where unnecessary travel, unnecessary congregation, unnecessary face-to-face meeting needs to be avoided. It has become very important. So it's now taken a shape, and it's also taken a shape further with its new set of guidelines being put down by the Medical Council, where in the past, in the absence of guidelines, as you can imagine, giving consults over the phone could have its own legal ramifications, especially if something went wrong with the patient. Now, those have been well taken care of within the legal framework as well. So it's now an established methodology of advising people on the disease process and advising treatment. The second aspect of it is look at how we can take it further. Why do people need to travel anyway, even if this all finished off? Why do people need to travel in the thick of traffic, waste a couple of hours, congregate at a place, waste their time, especially in the times of fact that they can't get leaves from their offices? Some people have to go to work, some have children to take care of. And then what we're advising is waste your half a day to see a doctor for a routine thing. So clearly, this is going to now, having learned the fact and having fitted into a formal medical legal framework, we're actually ready to take this new norm much forwards, even when everything normalizes. That goes for virtual. But look at the virtual hospitals which can be created. Look at the way virtual, for example, treatment of diabetes. There's no reason why even now at the moment, the people with COVID-19 who have been actually at home have been actually being monitored in multiple ways for their oxygen saturations, heart rate, temperature remotely. So you can actually create a remote hospital looking after a spectrum of COVID patients from one room in the hospital, looking after 20 COVID patients at home. This goes to diabetes, this goes to hypertension, this goes to other disorders in the future. So the virtual hospital for minor diseases can move to the hospital. The artificial intelligence is coming forth and realizing that, say, reading of X-rays, which is sometimes the first sign of someone developing a COVID disease, or CT scans, which is the first sign which can predict COVID disease, can be done by artificial intelligence. Even your own symptoms to say whether it's COVID or not COVID can actually happen through artificial intelligence. And that's happening in parts, but that's happening in soft parts. Also, the fact that one can look at, technology has even progressed further into all this. 3D printers for creating masks. That's coming. 3D printers for creating PPEs. So West has, of course, here in India, we don't need 3D printers. We've got so much of people to be able to create jugars, to be able to create small-scale industries and be passionate at creating small-scale industries, so that we've been able to ramp that up. But in the West, it became much cheaper to do 3D printing and create masks and PPEs. So that's been another big. But look at one of the great aspects, the Arogya Setu. Why shouldn't we talk about that? Arogya Setu is one of those aspects. This app is one of those aspects of how information technology itself has progressed into control of disease processes, into protecting ourselves, into actually analyzing the data, including telling us how safe we are, including changing our lives daily. So that I can tell you, Sai, is one aspect. But look at the other aspect, which I now find more disabling also. So these are the advantages. See, we as doctors always need to be in close contact with our patients. I don't think I can diagnose a disease correctly if I didn't examine a patient. And you know how, as a medical student, the biggest emphasis is, for years and years, is how to listen to the heart, how to examine, how to palpate. Actually, the clinical decision-making is till you examine a patient. The second aspect is the soft touch. Listen, I'm talking to you. Unless you see my facial expressions, unless I put an arm around you and say, you're going to be fine, unless you see that softness in my eyes, the empathy, how will a patient get the confidence of his treatment? Now, it is funny that earlier, nearly half the patients used to tell me, just by speaking to you, I'm comforted. I know I'll get better because you've already made me half better, okay? Now, look at the wrong side of things. I'm masked. I've got a visor in front of me. When he sees me in the OPD, I've got a plastic curtain. I'm actually communicating with me. I've got a cap on. So I've got a cap, I've got a mask, I've got a visor, and he doesn't know who he's speaking to. Then I admit him for a procedure. And he always sees me masked and visor, and this is the sort of visor I have to wear all the time, like this. And then I do a procedure, and 2 days later he's going. He's been masked and I've been masked. We won't recognize each other the next day without masks. So sad. So what do? I actually take my mask off on the last day when they're about to go. Take my mask off, I take my visor off from a 6 feet. I say, you take your mask off. We need to know each other. We need to be people. We need to, that when we meet outside 2 years later, we need to recognize each other and say, Dr. Seth, my friend, how are you doing? We cannot be masked men, in that manner. How the medical students going to be taught? I used to think now. I said, they're not going to be taught from a distance. I think they're not even going to approach a patient. They're going to be able to have to start recognizing signs and symptoms from 6 to 10 feet away and say, I'm diagnosing that you've got anemia because you look pale. How are they going to compare? To what are they going to compare? So I think I think we've got to strike a balance. That's what I'm saying. There is going to be virtual. You are going to distance. It is good for patients, but you just got to limit it at a particular point. You can't practice medicine by staying away from patients and your patients staying away from you. There has to be a touch. There has to be a contact. There has to be an examination. There has to be a proper diagnosis, and there has to be a final treatment. And it's finally you're treating a patient. You're not treating a machine. There has to be empathy. There has to be a bonding, and there has to be sentiments.
So as you mentioned, it's the last 3 or 4 months where we've seen a technological boom or a boom in virtual healthcare and stuff. A lot of the unrequired things such as travel and things are probably going to be reduced from now on. So as the saying goes, necessity is the mother of invention, and there is a pressing need for innovation now more than ever. So what do you think are the low-hanging fruit? What problems do you think are low-hanging fruit for innovation today?
Oh, so I do believe that, of course, leave aside the medical side of things where there's a lot of innovation still to happen. And we'll come to that, we'll come to vaccines and everything else. But when we talk about patients and dealing, yes, there's a lot more now to be able to see what all disease processes can be treated at home. So there's that aspect, monitoring and therapy. So we have the opportunities to look into every aspect of home care in a much bigger manner, saying what are the hospitals needed for and what should we limit hospitals and emergency care for, so that patients don't have to travel. For example, an abdominal pain could be serious, could be non-serious. A headache could be serious, non-serious. How can we actually handle these, which would be otherwise emergency problems? So there's a whole load. Most of it revolves around use of artificial intelligence and technology, much as we discussed. When we talk about, yes, the other aspects we just briefly touched, artificial intelligence needs to be used in a much bigger manner to again be able to decrease the number of personnel, because we're always going to be short of healthcare professionals and personnel, even in a country like ours. We therefore need to expand it to 3D solutions for all this. That's another aspect which is hugely important. I think the mind can actually work around, but I also want to tell you this. Like I said, is this going to be a change forever is what we've got to decide. Were we actually moving in the wrong direction in the past? Not necessarily. In India, we've always had the closest touch with the patients. It's the West which has been distanced from the patient, and the more West you go, the greater the distance from the patient in terms of bonding, should we say. Here, we've always relied, whether it's education, whether it's teaching, whether it is any aspect of interactions, it's always been a touch principle. We don't want to move away from the touch principle. We don't want to move away from the physical aspects. There's certain things, okay, new norms will have to come in. Education will in itself will have to change in a new manner. But again, the face-to-face principles cannot go away forever. That's what I'm actually have to understand. They will be coming back over a period of time. We've only got a void of a year or two, and then gradually we will overcome this, and we'll have to come back to a face-to-face, touch-to-touch principles in the long run if humanity has to survive in its present manner.
Yes, sir, I do believe that people do find the right balance, because in the name of a digital era, there is always a chance of people completely switching over.
Yes, dissociation,
on that
isn't
note,
it?
yes, sir, definitely. Yes, sir.
Yeah.
On that note, since we're like 5 months into the pandemic, I wanted a perspective from a solution point of view. So far, more than a dozen COVID-19 vaccines from over 100 candidates globally are currently being tested in humans. Yeah. However, no vaccine has yet been approved for commercial use. Recently, Bharat Biotech has claimed to have successfully developed India's first COVID-19 vaccine called Covaxin, and said it has the permission from the drug controller to start human clinical trials. Now, how does Covaxin compare to the other vaccine candidates around the world, and where does it figure, and where can you place it in the global race for a COVID-19 vaccine?
Right, a very important question. And just to give you a perspective, that vaccines in the past have taken up to 10 years to actually create and be successful. So we are on a fast track because of this pandemic all across the world. We're definitely on a fast track across the world. And there are 150, last count was 150 vaccine under various stages of trial, out of which 20 have actually reached the human phases, which is called phase 1, 2, 3 studies. And out of which only 3 are in the phase 3, which is large human studies in all sorts of patients. So where does India stand? So India's Covaxin is, say, in that 20 of the 150, which are at the moment under various stages of investigation. India has 6 or 7 companies actually looking into various types of vaccines. The Bharat Biotech, which is in association with the Virology Institute of Pune, as well as under direct interactions with ICMR, is the front runner of India, should we say. But it's one of those 20 in the front across the world. So the one which is far ahead is at the moment is the one from Oxford, one with Oxford and AstraZeneca called CHADS OX1, which is in phase 3 human studies, and we're just going into phase 1 and 2 human studies with the COVAX. The different types of vaccines. Covax is a very promising vaccine. It has to go into the phase 1 and 2 studies, which means dose ranging studies looking at safety and efficacy, then into a larger group looking at safety and efficacy. And then comes the phase 3, which is literally thousands of patients of all sorts, elderly, young, etc. Because of phase 1 and 2 are healthy volunteers. The rest go into every aspect of the community, to 10,000, 20,000, 30,000 people, looking at its safety and efficacy. That's the time frame. And however much we may shorten it, we're still looking at a few months of a time frame for the development of a vaccine to be available to human beings. So in general, it is thought that for us to actually have a vaccine available is going to take, by the end of the year, at least the fastest track can be end of the year to have a vaccine. Now, which vaccine is going to be successful is the next question. We are actually at the moment fast tracking it, in the sense that even when even when it's in phase 1-2 trials and the safety and efficacy haven't been proven, the companies have the ability to manufacture large doses the moment it got proven, rather than have a stepwise manner where you first prove it, then say, okay, let's set up the manufacturing facility. Now let's start manufacturing the vaccine. All that has been fast tracked by investments into saying the moment it's proven, we will have thousands and thousands and lakhs of doses available for rapid production and institution. So let us see which vaccine works. That's also the case, that we've got to keep our breath holding. Multiple vaccines can also work. So while this is the one with Bharatech is called an inactivated vaccine, the one which is being the front runner at the moment from Oxford AstraZeneca is a live attenuated vaccine. And then the Americans are developing a RNA vaccine and a DNA vaccine. So there are different forms of vaccine. They all have a different mechanism of functioning. For example, the dead vaccine, which is what biotech's all about, is a dead virus. It cannot replicate, but the body senses it as a enemy, and the body therefore creates antibodies towards it. But it cannot replicate inside. While the Oxford vaccine is a live attenuated virus, it uses another virus which hasn't got the ability to spread and harm, to carry some of the proteins of the SARS-CoV-2 virus on it, and then it goes into the body, and the body senses it as SARS-CoV-2 virus because it's got this protein bound on the lesser virulent virus, and creates antibodies to kill it. So there are various mechanisms of it. Promising, but it'll still take its own time for safety, for efficacy, for dose ranging, and then a wider application of safety and efficacy.
Yes, sir. I don't think we realize how many factors go into developing a vaccine.
In simple terms, Anushri, if you took out a vaccine, and remember, vaccine itself is an agent, is a foreign body being inserted for the body to sense it and create antibodies. If it wasn't safe, you could actually cause harm to the patient also. If it isn't effective, then you can immunize, and at what dose is it effective? Then you can immunize hundreds and thousands only to realize 6 months later that people are still getting the disease process and the immunity only lasted for a few weeks. So the duration of immunity becomes important as well.
Yes, sir. So many factors go into this.
Yes.
But as such, in the health system, another very important factor is health financing. How can the government enforce sustainable financing of the healthcare system and ensure the availability of adequate, affordable treatment options?
Oh, that's $1 million question, isn't it? Yes, and we've been struggling with this. That's why our healthcare system has had so much problems over the years. And now this is going to take 2-3 minutes to do stay with me on this, because it's an important aspect. In fact, it's probably the most important aspect. It deals with our healthcare to our own people. How do you? So here's the situation that India never actually took healthcare seriously and investments into healthcare seriously. This is the first time that a wake-up call has come into saying healthcare matters. Healthcare, not just health of people, healthcare matters. And healthcare, when we start understanding, is not just the hospitals and the treatment you give to them, but it's the whole milieu of delivery of medical care, delivery of therapy, treatment options, drug industry, device industry, new devices, production of various equipment, techniques, science, research. It is this whole, what we call healthcare. That's what's been missing. So what has happened is that a whole Australia, when I was in medical school college 40 years ago, we were taught a whole Australia gets added onto India every year. And we were far behind in our funding, and we never saw the path, the road map ahead. Now when we start realizing it, we got a 1.3 billion population. We got 17% of world's population, 20% of the diseases across the world. And we are totally outstripped in our resource, either infrastructure or cash for them. So how do we partner it? What did India do? India, in a way, was a fallacy where, because the government could not support the healthcare structure, there was a default strategy of letting private medicine grow. That was a default strategy because somewhere or the other, patients were getting their care, whether through small practitioners or whether through small nursing homes in smaller cities. And then there was a proliferation of bigger hospitals. And then in the last 15 years, proliferation of corporatized healthcare. But the government just sat back and said, that's a big headache off our heads because we haven't got the ability to provide 1.3 billion people our infrastructure. Now we got to take advantage of that private healthcare, not to actually start creating perceptions that private healthcare is all sinful, bad people. They're not. After all, it's private healthcare which contributed to the greatest advancements of science, technology, the best hospitals, the greatest treatments which were available in the West have been brought here. And that's why people flood to the private hospitals. But what it is needed is really, how do we regulate everything in a manner that there is trust, that one can work together? See, one of the easiest aspects of the government at this stage is to say, let's look at primary care, prevention, disease processes, sanitation, hygiene, that any government should do, and that should be the responsibility. And let's create some tertiary health centers, which should be truly tertiary for the public. And let's partner the private healthcare, now that it's progressed, and now we've let it grow for 30 years, it's contributed to this country. Let's move away the disparity of 70% of the private care being in the big and nothing in the smaller cities. Let's partner them in district general hospitals, partner them in secondary level care. Let's just combine the two together, remove trust. We've got those hospitals sitting there with poor facilities in the district level. They've got extremely poor facilities. They're devoid of expertise. They're devoid of good doctors. They're shabby and the equipment's not there. Let's private players put in money. Let's actually say, and just say, treat 50% patients totally free. Take X amount of money for the ones you're treating. Create partnerships which are sound, which are profound, with trust, sitting around the same side of the table, getting the device manufacturers in, getting the drug manufacturers in, getting the patient's representative, and say, how do we at secondary, tertiary, and quaternary level provide the best partnerships which can deliver care at affordable levels? And nobody, so take away the profiteering away, but do not put caps which are so bad, which are uncalculated, which have not got the inputs of any private players, and say, we are actually going to impose this because that's the only way we know how to function. That actually drives away any new technology, any new science, any new innovation, any new ideas away completely. Either the private healthcare should not have been allowed into the country, and it should have all been government regulated like UK does, National Health Service, it's all government. But if it was allowed by laws to flourish and support the healthcare system and get the best technology techniques into the country, which the government could not deliver, then let us now combine the two together with trust, sit around on the same side of the table and say, how do we create a new India with a new healthcare delivery system? I think the opportunity is great. I think the public-private partnership is the future. I do believe that the trusts have to be come in, the suspicions have to be moved, the bad mouthing of each other has to go away, and that's the way forwards. Let's not make out one as criminal and the other as sinful. Both are doing their best job in giving the healthcare services to this country, be it private, be it vertical, but they can't run. Anisha, you can imagine, they can't, these two verticals cannot run as train lines, looking as if they're meeting, but never meeting together. That's no healthcare delivery.
Yes, sir, I strongly agree with that perspective. And it's actually very interesting when you think about it, because those sectors have to work in harmony for India to develop as a nation on every sector.
Yes.
And one more pressing issue that we have to talk about on the global scale is the role played by the World Health Organization. Talking about the current situation, WHO claims that in terms of the pandemic right now, the situation is only going to get worse. How so, and what do you think are the main factors that play a role in this, and how do you think we can combat this faster?
Right. The WHO says this based on the infectivity of the virus and the fact that we still haven't got a proven treatment for it, and vaccines take time for prevention. And therefore, at the moment, as you know, lockdown was only a methodology in the first phase to prevent the spread of the virus widely, especially in congested and highly populous countries like India. And secondly, was to ramp up the infrastructure. And when we talk about this infrastructure, this is an unheard of infrastructure. This sort of infrastructure, even the West, which is supposed to have the maximum number of beds per 1,000 of population, actually went bereft of the infrastructure. This is not the normal sort of infrastructure we're going to need in the future. We're never going to need, in India, it probably will, we need beds because we've always been short of beds. But the West had to create bed strengths which are never going to be needed. Now, having come to that, the real issue is that opening up is a reality. It's a socio-economic reality. The WHO says this based on the fact that because vaccines will take time, because proven drug treatment, which will save lives, are still under trials and in the next couple of months may bear fruit, what is left is human behavior. And therefore, we are now relying on human behavior to stop the spread of this virus. India is lucky that the number of deaths are 1/3 or 1/4 of what is happening in United States or UK, where deaths is 10 to 14%, and India is at 3%. We're also lucky that we've got less serious infections than the West. But if you see, it's only what's going to stop the spread of the virus is what we said earlier. Hand washing techniques, hand hygiene, physical distancing, and masks. And that is why it says that it's there to stay, that it's going to get worse if we don't behave ourselves. And you saw that, by the way, Bangalore was looking good. It's again started the spurt up. You see in United States, the peaks had happened at 30,000. It came down and now the peaks are going up to 50,000. You saw New Zealand declare 2 weeks ago, no virus. And suddenly they opened their doors and when they opened the travel and people start coming into the country, you start seeing virus again. So that is the reason why it's said the virus is going to stay safe till everyone gets vaccinated with a vaccine which gets proven. We only have our own vaccines, like it was said, to take care of. We are the vaccines, and we've got to take care of it ourselves. That's all.
Yes, sir, absolutely. We all need to do our own part to flatten the curve. And what else can we do as a community to slow down the virus apart from hygiene? And
see, as a community, it's a realization issue. We ourselves owe it to create that sort of information to the public. Now, there's one aspect that we have to understand for India. Physical distancing, as we say, can be a harsh, cruel joke for some of the people who are in very troubled socioeconomic status. I mean, when you see the slums in Mumbai, when you see the congested surroundings and where people have to stay, 6 people have to stay in a single room, are on daily wages, for them, their survival from lack of food, from sanitation, from hygiene, from infections is a far bigger reality than worrying about a COVID-19 disease. For them, where the next food is going to come from is an important issue. From where they've not got even water and sanitation and hygiene. There's one person, there are 100 people using one bathroom. So I think that's a harsh reality. That's something which is India needs to analyze now for the future and say, how do we upgrade the standards for our public, for our people? There's a lot to be put into India for that matter. And that whole socio-economic fabric of the country has to be elevated. But the second aspect is, unfortunately, they're actually undereducated or are deprived of intelligence, a lot of deprived intelligence at the upper educated strata as well. And that's not only to India, that's across the world, where you see people wanting to take masks off and say, it doesn't matter if you get COVID, I'm going to live a free life. But we have people now, as we open up, you realize we have people up having fun on the streets, putting a mask on their cheeks, putting a mask on their mouth rather than their noses, actually talking to each other, still having cups of tea, still having cups of coffee together, not realizing that the virus spreads even at workplaces from each other. It's like a bank I went to. Let me tell you this. A bank I went to. The bank people were making sure that I, as a visitor, was fully investigated. So there was the bank, there was the chowkidar, the chaprasi of the bank who still had his mask off, giving me the sanitizer, and I moved away from him saying, you cover your face first, then give me a sanitizer. I go to the teller. I'm actually 6 feet away from the teller, but the two tellers have got their masks down, talking to each other. One hasn't even got a mask. I saw the assistant bank manager. He had 3 people around him. They weren't wearing masks. They never felt that they would get it from each other. They only felt that they could get it from me, so I had to be 6 feet away from them. But actually, that's what's happening. You believe that you're going to get it from somebody else. You could actually get it from somewhere near you. And therefore, it is the workplace. Ethics have to change. The psychology has to change. And we, as a responsibility, have to make people understand that. So when you say, what can we do? We, as individuals, have to keep enforcing this to our own colleagues, to even your own co-students, to your people who you live with daily, who you work with daily, who you travel with daily, have all got to understand that these are meant for you to stop spreading of virus to the others. You're not just taking care of yourself, you're actually helping others. It's like smoking in public places. If somebody smokes on your face, won't you actually just lose your cool and say, why are you smoking on it? That's the way you have to look at the mask and say, why have you got a mask on your nose? Stay away from me till you put your mask on and stay 6 feet away. I think it's got to be an education. It's just got to be a change in idea, change in philosophy, change in how people have to realize. More of us have to do that. And more of us have to help the poor people, by the way. Let's not forget that. Let's not forget our social. We cannot blame how many people, half the country lives in poor socioeconomic strata. We actually have to help them. We actually have to make sure that they stay well. We are the ones who take the responsibility.
Absolutely agree, sir. I hope this is a huge wake-up call for everyone as a community and as individuals. I think everyone will be a lot more careful about their hygiene and about how we think as such. So that is all, I think. It was a pleasure to have you.
I took too much of time of yours.
No, sir, absolutely not. This was a very engaging and informative session. And yeah, it was a pleasure to have you on Pragyan Talks, and I'm sure it was very informative for the audience as well. So it has been a privilege to host you, and thank you so much for your valuable time.
Thank you, Sai. Thank you, Anushree. I think it's been a pleasure talking to you. Do well in your lives. Be the greatest ambassadors which India has seen. Remember everything I've said. I got to this just as a little word of inspiration. I've achieved a lot, thankfully, due to multiple reasons, but it's all hard work and devotion and passion. I work till 12 o'clock, 1 o'clock at night. I continue to see patients. I'm still smiling at 1 o'clock. But one of the important things of life, I couldn't get into medical college for 3 years. I couldn't even clear the entrance exam of the medical college for 3 years. And I was good. It's not that I was bad, but I just wasn't focused enough. And so but then the persistence that I've got to get into medical school helped. I got it to 3rd year. And then I even flunked the first exam of the first professional exam, the university exam, after 1.5 years in the medical college as well. And it was, but then, I actually flunked the first few exams, and then I actually won a gold medal on my first university exam in the medical college. That really awakened me. Nobody believed I would get it. Everybody thought it was a joke. And they couldn't think that I would, because I was always, happy-go-lucky. They said, never get it. And that changed me. So there's always a time. So life revolves around, your competence is not based on your marks. It's not based on your exams. Your competence is right-based here. When it flourishes and when it transforms you, from there on, you never look back. Then you always stay on the top. You never go behind. So it's there, innate in everybody. Nobody would say a guy like me may not have ever got into a medical college or failed to get into a medical college for 3 years. Couldn't get to an exam. Only one medical college took me in after that. But then that's life. So everybody has the spark. Everybody has the brightness. Everybody has the rare to go. You just have to, it comes on once, and from there you say, the world is going to be ours.
Yeah, so that was a wonderful takeaway message. And I think a lot of viewers who are subject to this Indian education system will find that insightful.
Yeah, thank you. Thank you, Sai.
It was a pleasure to host you, sir.
Pleasure talking to you. You take care.
Thank you so much, sir.